the Carraroe agus gur míl mágad ar a táságam nach bhfuil an tarasláinte an anbheithan seo inniu agus is mór an trúa ach tuigim go bhfuil crinú eici. Is dótha tá orm an tábhar seo ordú a ríis agus bhreithní mé siar cé comininic is atá sé ordaí agam agus chuir sé altóachta mí áíire go bhfuil mé fós i cant faoi Áras Mhic Dara i gríleáin na Gaeltachta ionad le a bhfuil dúnta atá dúnta inis ó am Covid. Agus na cúisina tífír den an áte bheith dúnta tá siad a gCeathrú an tam lug as be fórne, as be éileh, módúil nua. Agus an uair dhearnach dúirt mé go raibh sé thar a bheith deacair gan a bheith éadóchas ó híomh na freigraí atá á álagan agus tá mé sa cás cennig chéine inniu agus i gcoil siar cúpla cheachtain bhí crinú peibli I Connemara maidir leis an ábhar seo agus drastal cúpla céad duine agus I áíire ní rah mar anán na teachta dála a bhí an, ní rah méid an a bhíú dómh cén fá go raibh an tonad lééis seo fós dúnta. Ní rah mar anán agus bhí sé sin andeacrad dúine mar teachta dála. Unad co-reachtanach seo a bheith dúnta. Minister, unfortunately, for rear gear, I have to raise the continued closure of the day centre in Connemara. I raised it as a topical a few months ago. I've raised it under promised legislation. I've raised it everywhere. And when I looked back, and I'm sure I'm going to get the same answer from you today, and I really hope, I know you're in a difficult position and that the Minister Butler can't be here today. And I had the choice of not taking the topical today, but I choose to take it because it's so important, because the ongoing closure of the day centre is simply unacceptable. Now, I would ask you, if you could depart from the script, if it's no different from the last script, because at some stage we need human intervention here from ministers and the government. If the explanations keep changing, we're in the middle of a Gaeltacht area and they're telling us, I have a presentation here, look at the size of this file. And we got a wonderful presentation on Zoom, and we were told it was going to open in April. April came and went, April Fools presumably. Then May came, we were told it was going to open, and they managed to open it for one day, and then they closed it, and they told us there was no demand. Now we're talking about a day centre for elderly people that everyone attended before COVID, and then we're told there's not enough staff, then we're told for infection reasons, then we're told there's a whole new model of social care, and as somebody at the meeting said, they're actually telling elderly people that want to be able to run the city marathon before they can attend a day centre that's under the social model care, because they have to be able to entirely look after themselves, take their medication and so on. That's the social model care, which is not suitable. I've no difficulty with it, but it's not suitable for the people we're talking about. Then they opened it for a day and nobody knew that it was open. They didn't tell the radio or the papers. So now we have a situation where HIQA has visited 3 times in the last number of years. The last one gave a glowing report in relation to the nursing care. Unfortunately, this time and the last time, they don't even mention the day centre, which is of great concern to me. And it's underutilised as well in terms of the bed capacity. So it's getting a glowing report, glowing from the staff and from the residents. However, it's underutilised as a nursing home, and as a day centre, it's non-existent. So what am I doing, really, as the end of term approaches? I'm appealing to you on a human level. Please don't read out a script to me if it's the exact same answer as the last time, while understanding your difficulties and you're standing in for a minister. But please tell me, in your opinion, is this acceptable?
Minister, 4 minutes.
And I'm sure the Deputy will appreciate I'm not a minister in that department, so it's very difficult for me to come in here and depart from a script when I'm not over the issue, so I'd appreciate if we could be fair on the issue. On behalf of the Minister for Health and older people, I would like to assure Deputy Connolly that the Government has been driving important reform initiatives, working to deliver on the objectives of Sláinte Care and building the capacity of our health service to address the changing needs of our growing and ageing population. A key focus of our Sláinte Care reform programme is recognising the need to enable older people to age well at home in their communities for as long as possible with the correct wraparound supports. Older people want to age well at home, and it is important that supports they need are in place, including wraparound services like home support, day services and meals on wheels. There should be no doubt that investment in social care and home support has been a substantial priority for me and the Government. In May, Minister Butler announced the allocation of €5.25 million funding for Meals on Wheels and day centres for older people to organisations right across the country. In addition to this, a further €2.1 million was secured for dementia-specific community day services. Access to centres can make an important contribution to our goal to support older people to age in place in their communities by providing invaluable support, advice and social interaction for older people who may, for any number of reasons, be experiencing isolation and loneliness. As the Deputy is aware, the Health Service Executive has operational responsibility for planning, managing and delivering health and personal social services. A wide range of core services are provided for older persons, including home support, daycare, community supports in partnership with voluntary groups and intermediate care, as well as long-stay residential care when remaining at home is no longer feasible. These services are fundamental to the health and well-being of our older population. Minister Butler is committed to working alongside the Health Service Executive Community Healthcare West to ensure that those who need access to health services can avail of such services within their community. The HSE have provided reassurances that, as previously committed to and planned, the HSE will provide day services at Áras Mhic Dara that will cater for 8 to 10 people. An area within the centre has been identified for providing the service. It is planned that 2 healthcare support assistants will be employed when the day service is operational, with the support of clinical nurse manager off-site. A minimum of 8 people is necessary in order to reopen this service. To date, there has only been 1 person who expressed an interest in the day centre. The HSE has advised the Department of Health that all communications regarding the day services have been provided to local public health nurses and general practitioners in the area. The HSE has further advised that the message has also been broadcasted through the local media, and the local politicians in the area have also been informed. Minister Butler has previously promised the Deputy that her officials would monitor the position, and they will continue to engage with the Chief Officer in Community Healthcare West on this matter. Carraroe.
2 minutes.
I think that I'm always fair, or attempt to be always fair, and I realise you're in a difficult position. However, you can understand my frustration on behalf of the people, where I've outlined a day centre is closed and the reasons for that keep changing, constantly changing. It wasn't suitable, the place wasn't suitable. Now I welcome the fact that there's a commitment to open it in the nursing home. That's new, because that has been changing all of the time. The fact that we have now been told, and the has been broadcast, that didn't happen. Do you understand? They opened it for a day without telling anyone and then said there was no demand. No attempt has been made to reach out to the area and talk to the people. We were at a public meeting, like I said. The GP spoke for at least 20 minutes outlining the great need for the day centre in the area. None of that seems to have taken hold with the Health Executive. I want to work with the Health Executive. In April or March, when they made the presentation, we were delighted. They gave us a date for it to reopen, and it didn't reopen. So when I stand here, agus frustagus orm o hív an ábhar seo agus gohfuil an tonid fós dúnta, is son winsear a cheantar atá sin á dhéanamh agam. Bheadh sé go bhfad níos éasca gan an tábhar seo a ordú go rialta mar atá sé ordaí agam. A laid inis tá gealún si go mai an tonid nua an tseirbhís á oscailte arís le stitain onid agus go mai fuirden curra fáil. Ach tá bhfad níos mó oibre ag tastal chuna curra nual don the daoine go bhfuil an tseirbhís ar fáil. This has to be resold to the people, Minister, in relation to telling them that this day service is essential, it will be there, it will be functioning, and there has to be an educational programme and a communications programme in relation to that it's open and available.
Look, and I note your contribution, and I will raise it with Minister Butler in terms of the local issues that, in terms of really advising people of the process that's in play here. Also, obviously, Minister Butler, as referenced in my opening statement, announced €5 million for daycare centres and Meals on Wheels. And obviously, this is very pertinent, very important, key to the local community, and I will bring it to our attention. But obviously, while not in that department, I can't go into any further detail at the moment. Margaret.